There's been a lot being said in the last probably 3 or 6 months about infertility. There are a lot of questions coming up. What is infertility? How do I know that I need to go and see a doctor? What are the signs? And that's why today we're going to talk about what is infertility. This is Dr. Wanjiro Ndegwa Juguna at Footsteps to Fertility. Let's get the conversation going. What's infertility? I think I'd say that infertility is definite. So I'm not going to talk about infertility. I'm going to talk about subfertility because on this show, we're giving hope. So I would say that if you've been trying to conceive and it's not happening within a year, for people who are under 35, then there might be some little problem that needs to be fixed, and that's subfertility. And if you're over 35, we'd say if you've been trying to conceive and it's not working within 6 months, then we try and wonder, okay, is there something that needs some fixing, or is there something that we could do to help? So what infertility is, or what subfertility is basically a struggle to try and conceive. And how it is depends on the time. I think it's important for people to know that there could be primary and secondary infertility or subfertility. And what primary is that, okay, I've never had a child, never had a miscarriage, never had even an ectopic pregnancy. That's primary, where we've never ever had any pregnancy. And secondary infertility is where I've had a child, or I've had a miscarriage, or I've had even an ectopic pregnancy, because that's pregnancy as well. But then after that, we're struggling. So those are the two types. And both of them really are caused by the same things and really need to be looked after. Again, I'll reiterate, the time frame is 1 year in people who are under 35 and 6 months in people who are over 35. Time, why does it change? It changes because people who are over 35 tend to have less eggs, for the woman part. And therefore, if we're not conceiving within 6 months, we then need to see, is there a problem with the eggs, and therefore is there something we can do? So who do I see? Who's the person to see if I have a problem? And it's important to note that there are doctors that are specially trained, and these are doctors called reproductive medicine specialists. These are doctors who've done their 5 years, they've done another 4 years in OB/GYN, which is obstetrics and gynecology. But after that have done another 2 years in this field of reproductive medicine. So this is a super specialist, and this is the person that you should see if you have trouble conceiving. Another question, how do I know when to go? So we've already said the time frame. If you're over 35, if you've been trying to conceive 6 months, we need to go. If you're under 35, please wait. And that's what I tell people sometimes. Some people come at 3 months and I'm like, it's too early. Just try, have fun, enjoy the marriage, enjoy the process, and usually you get pregnant. But if it's over 1 year, then we need to see you. Then we need to see what else can we do, or is it just, there's also unexplained, so there could be nothing wrong. But over 1 year, we need to do some tests and actually see you. What other things for a female would cause her to think to come a bit earlier than that 1 year? There's some conditions that should ring a bell and make you come to the doctor earlier. So some of these are patients who have endometriosis, and I'll go into a huge explanation of what endometriosis is. But one of the things that endometriosis does is give you extremely painful periods. So if you're a young lady who has extremely painful periods that debilitate you and don't allow you to go to work and are trying to conceive, perhaps you should come a bit earlier. Another thing is women who actually don't get a normal regular cycle every single month. So some women have cycles after 6 months, or after a year actually, or even 3 or 4 months, and where they don't have their periods for that, in the course of that time. And for those women, it's important because what it actually says is that you're not ovulating every single month. And therefore, you should come a bit earlier and see whether you need any help. For women, another reason would be if you have diabetes or if you have any thyroid issue or any other diseases that may be related to your reproductive system, you do need to come earlier. If you have fibroids or you've been told you have polyps or there's something wrong, you still need to come and see us a little bit earlier than the 1 year or 6 months. There are lots of other reasons, but we'll expound on that as well. For the male, I think it's important for males to know themselves and own their bodies as well. And so for the males, if you have, say, you've noticed that either your scrotum, your testes are not there, or there's a problem with an ejaculation or an erection, I think for those men, you need to come a bit earlier to see us, or any other instinct that you have. I tell people that to follow their instinct. Most of the time, it's necessary. So those are the reasons that you should come and see a fertility specialist. If you've been trying to conceive for over a year and you think there might be a problem, my advice is that you should see somebody, see a specialist. Let's see what's the problem. Let's solve the problem. And there is hope. Some problems are, just very simple to solve. Some are a bit harder, but most of the time we can do something about it. So please don't wait until you're too old for women. And for men, please accompany your wives. Let's be a couple. Let's support each other in this journey. This is Dr. Wanjiru Ndagwa Juguna at Footsteps to Fertility Center, where we walk with